So the lateral center edge angle gives us an understanding of the coverage of the femoral head by the acetabulum. The normal angle here is between 25 to 40 degrees, and you can see this is the angle over here on your screen. Hopefully you can appreciate that if that angle was larger, you're looking at more coverage of the femoral head by the acetabulum, potentially lateral over coverage or a deeper socket. You're starting to think about pincer impingement. And you can hopefully appreciate that if that angle was less than 25 degrees, so much smaller, you're looking at a lateral undercovered femoral head. And so potentially an upsloping saucile could give you that as well, which we'll talk a little bit about. But looking at lateral instability there and potential hip dysplasia. Now, this is just a video here of me measuring this lateral center edge angle on a patient of mine. So I'm going to start off with drawing a circle of best fit around the femoral head. This also gives me a reference point in the center of the femoral head. This is on IntelViewer, which is a software program that we commonly use for a lot of our patients. I'm then going to select something called an orthogonal measurement. So here I need to start with a transverse reference line. I'm going to draw that from the teardrops of the pelvis. These are the white weight-bearing zones that you can see here. And the orthogonal measurement gives me a line that's automatically perpendicular to that, so relatively vertical. But this will take into account any kind of inclination of the pelvis before you start to draw your angles, which is really important to do. Here I'm going to start off with a line that is parallel to that relatively vertical line, and then the second arm of the angle, which we will manipulate in a second. This angle is going to be anchored in the center of the femoral head, which we have our reference point from the start, and then I'm going to move that second part of the angle to the lateral saucile. The saucile is the white weight-bearing zone here at the top of the pelvis, and that represents how much coverage functionally that patient has of their femoral head by the acetabulum. If that is, again, as I mentioned in the earlier slide, if that is over 25 degrees, you're probably looking at over coverage. Sorry, if that is over 40 degrees, then you're potentially looking at some over coverage. If it's less than 25 degrees, you're looking at potential under coverage and potentially indicating hip dysplasia. And you can see on this patient, it's roughly about 18 degrees. So this patient would be easily diagnosed with hip dysplasia. And this patient did have this missed on their X-ray report. So a good example of someone that is worth measuring yourself and having a good look at the X-rays yourself.